now move on to motion 3, the Liberal Democrats group motion on Benjamin Court. Councillor Acklerone, if you'd like to propose this.
Thank you. I have a seconder. The Cabinet Member's response to Councillor Connolly's earlier question confirms my belief, colleagues, which is that this decision was taken without the appropriate public consultation. How do you know this is what people want when there's been no consultation with users or potential users? I'm sure you're aware there are 4 areas which are subject to statutory consultation, and I believe this decision fits up to 3 of them, given the extent of the changes. It was, after all, sufficient to trigger consultation for staff, but only just in May, after no public record of any discussion on this council. What about people who can't appropriately recover at home, who'll be made more vulnerable? For example, those without the space or the connectivity, whose homes are not laid out or accessible sufficiently for safe reablement treatment, or may even be filled with the result of other issues, such as hoarding. Convalescence may be an old idea, but even in today's modern healthcare terminology, it's much more widely defined than was stated, and it includes specific reference to recuperation. Reading through all the available guidelines for reablement, it's clear that in many circumstances, these services should be delivered jointly by health and social care providers. You could almost call it integrated care. In fact, it was to enable this way of working that this council reopened Benjamin Court only a few short years ago, and with great triumph. Make no mistake, the closure of this facility is dreadful news for the residents of North Norfolk, and it's another example of cuts to our health and care service. We've had a care crisis which is being made worse for our most vulnerable and elderly residents by what happens between hospital and home. And it's well established that proper support after treatment leads to stronger, longer-lasting recovery and reduces readmission. I cannot understand the logic of closing one of only a small number of convalescent units where patients can be discharged from hospital to recover. It's naive and unrealistic to think that home-based care can provide the same support in all cases. From shutting surgeries to trying to ban visas for care workers, Conservative MPs locally and nationally have brought our NHS and social care to their knees, which is why we should all welcome Liberal Democrat leader Ed Davies' major package of costed, largely self-funding support for social care announced at our conference on Saturday. We've already heard today how there is frustration across this chamber with our county's MPs not acting decisively enough in the interests of our rural communities. It's time we changed our politics to rebuild our health services as well as our coastal management approaches in a way that meets the needs of rural and coastal communities. But before anyone starts growling that I'm bringing politics into a political chamber, let's be absolutely clear about the practical circumstances. Delayed transfers of care, failed discharges and unmet care needs. Other than the consultation, these are the considerations which should have been front of mind in making this decision. I and my Liberal Democrat colleagues have been watching these numbers carefully, and I recognise the work done by this council to reduce unmet care needs and that the recruitment drive for care workers has succeeded for now. But closing Benjamin Court will inevitably end up placing more reliance on private care settings for short-term care home visits. We know there's high staff turnover in the sector, and this decision risks turning back the progress that has been made. We also do still have unmet care needs in Norfolk. We also have the ongoing issues of delayed transfers of care and failed discharges. And place matters. More than anything else, the people of North Norfolk are about to lose a valued local community medical and health facility. We have little faith that returning it to NHS estates would lead to anything approaching the same service being carried out anytime there soon. And I'm sure it makes sense, given the nature of the support we're talking about, to provide that support as close as possible to people's homes, their families, their communities and support networks. The questions that have been asked about how appropriate support will be provided seems to receive a carousel of different answers. It's surely time to pause and reevaluate this short-termist decision. If not, I expect we'll carry on going round this not-so-merry merry-go-round in 5 years' time. NCC will again don the Emperor's new clothes and will be asking for it back. Please support this motion and help keep this valued facility doing the job it was until very recently doing very well. Thank you.